showing that I'm recording. I'm showing that I'm streaming. So at the very worst, there'll be a recording that will be worth watching at a later point. So let's get started. So where am I? I'm in this little cabin. It's a tiny house, and it's a tiny house on my daughter's farm. So this is located in the Cowichan Valley near the city of Duncan, right in the middle of Vancouver Island. Exciting for me. So just a heads up, I'll be hosting a couple of Bowen therapy courses in BC and Tawasin in the lower mainland, and then in Mexico. So those happen in March and April. And then some of you may know that I've produced a new online course named Homeopathy Simplified, a course for body workers and everyone else. And I'm really proud of how well it's turned out. And I hope to bring some of that new knowledge into a revamping of Bowen-Online as well, which I'll get to later now that it's the homeopathy course is completed. And now I have a little more time. I can focus on Bowen therapy a little more and promoting Bowen and so forth, and hence this webinar. So this webinar I've titled All Bowen, Totally Hip. And I wanted to talk about intransigent hip issues and then also open it up for a Q&A session and then talk a little bit of politics or covering a few syndromes that I wanted to talk about, because we've all had, difficult cases of hip problems, low back problems, groin issues that have been hard to resolve. And we'll talk about identifying some of those causes, how to assess them, and different treatment options. So this is the list of those that I'm going to cover. So osteoarthritis of the hip, greater trochanteric pain syndrome, SI joint pain, lumbar facet syndrome. This be, I think, a very important subject. Pelvic instability, hip impingement, and iliopsoas syndrome. So I'm just going to run through those and go through some of the symptoms and then some of the, character of those syndromes. So you'll see on the screen a list of the main symptoms of osteoarthritis, but it's important to know that the hip joint is a ball and socket. It was smooth in the joint of the bone, the acetabulum. Mostly we associate it with deteriorating quality of the cartilage. Of course, age is a factor, but if you think of it as a smooth ball and socket, if you're walking around for 10, 20, 30 years with a slight rotation, I'll exaggerate that, and hopefully you could see that, you will wear that cartilage out much more quickly. So, the result is that your joint moves less smoothly, you have less range of motion, shocks being absorbed less effectively, and this leads, to, of course, to the chronic hip pain. So what happens as the cartilage deteriorates, you have the joint coming into contact with each part, and this is where the pain comes from. So the body may start to build up osteophytes, and that's an abnormal bony growth spur along the edges of the joint, making the joint wider. By making the joint wider, the pressure is distributed over a greater surface. This is the body's way of trying to limit the effects of osteoarthritis. So this is such a common issue, and of course surgery is the ultimate option. However, realigning the posture and allowing the joint to move efficiently can help create space where the cartilage could restore. And we'll talk about some treatment options later. So now we have another very important syndrome, greater trochanteric pain syndrome. So this is essentially a tendinosis of the hip adductors. The tendon structure of the muscles decreases in quality. So let's go back to a little bit of anatomy. The iliotibial band is a large band of connective tissue that runs from the pelvic ridge down the outside of the upper leg to the knee. It passes the greater trochanter along the way. So the trochanter is that lump on the side of the femur as it bends towards the pelvis. And it protrudes and therefore can be a site of rubbing where two structures rub against each other and create inflammation. So when those two muscles, which are part of the gluteus maximus and the tensor fasciae latae, TFL, and they rub against each other, they cause that pocket of inflammation. And in the old days, the doctors would just give a cortisone shot. But now that's a more specialized application here in Canada anyway. But there are many, many other options for treatment. And of course, again, the issue is the posture of the pelvis and the femur, how the femur is sitting inside the pelvic joint. Okay, so I won't go into too much more detail. I think that's pretty basic for everyone. And we come to another very important syndrome, sacroiliac joint syndrome. So this is considered in the past to be an issue of hypomobility, more stiffness, or hypermobility, increased mobility. And this can therefore strain or damage the joint's ligaments. And the symptoms are grouped under a name, SI syndrome. And you've seen this in your Bowen practice when you've had a patient stand up, walk a little, and then offered the sacral procedure, and you've seen how their hip moves so much more freely immediately after that simple procedure. So that's the question of where the ligaments are holding the joint in a misaligned state. So oftentimes the symptoms could be caused by an accident, a misstep, even on a stair. Mostly though, we see it as a result of pregnancy and delivering of babies. So that's a very important procedure in maternity care. And, we have also repetitive strains. If you're doing a sport like golf, for example, always swinging from one side to the other, even a basketball player, always, leaning on that. Any sport that you do that's not symmetrical could cause that sacrum to be stressed in one side or the other. So, the symptoms is mostly pain in a very focused area, but it can radiate as well. So that we all know. Now, a newer concept in diagnostics is what's called lumbar facet syndrome. So this falls under the heading of degenerative back pain. And this means that degeneration is its main cause. Degeneration refers to the fact that the quality of tissue decreases, and this can be caused by the natural aging process, but also by strain or a change in position of the spine. We see that in scoliosis or other just natural postural issues. And so what can happen is the strain puts pressure on those facet joints. Now the facets are the posterior part of the vertebrae, and of course small micro muscles and tendons are attached to them, whereas the anterior part, the front of the spine, is protected by discs. So it's as important as any issue that would lead to a disc rupture is this facet syndrome, lumbar facet syndrome. So what your body will do when it has some weakness in those facet attachments, it'll make compensations in the larger muscles into the hip joint. And that's why it has so much to do with hip pain. And it radiates oftentimes to the groin, the front side or back of the thigh. And something important that I've noted when I see this syndrome is that, have you ever worked on a lumbar of the basic relaxation moves 1 and 2? You release those muscles, the first moves of burn therapy, and you hear an adjustment happening. in the spine on one side or the other. Most commonly, you'll see the syndrome on one side or the other. And that could be a very big hint that you still need to address the hip joint in addition to the back as well. So it's a very good clue of when this syndrome may be present. And of course, you're not necessarily able to diagnose all these conditions. You may need an x-ray. And even what they'll do, in fact, is use a nerve block procedure to remove the pain and see if that relieves the accommodating symptoms, the referred symptoms that are elsewhere in the body. And that would be the diagnostic of lumbar facet syndrome. So we'll also look at that in terms of Bowen therapy, what would be helpful for that problem. Okay, so I'm just going to double check the recording and make sure everything is going well. Yeah, very straightforward. It seems to be working. And now I do see some chats, so I'm just going to quickly look at that. I'm having some problem with this issue. Okay, I can't even read the chat. Sorry about that. Let's see if I can bring it out. And see the questions. Sorry, my computer is actually a little bit slow as a result of trying to do this. My encoding is overloaded, it says. So anyway, I'm going to continue. As the pelvis structure consists of 3 bone segments: the left half of the pelvis, the right half of the pelvis, and the sacrum. So these are all independent structures. And of course, the sacrum is wedged in between these 2 halves, like the point stone of an arched bridge or window. And of course, this can all be unstable. So you can have a multitude of symptoms, and they're listed here: pain in the lower back, the coccyx, the abdomen, problems such as cycling or going over a bumpy road, and of course, menstrual and pelvic floor issues. When you get up from a chair or rise from bed in the morning, you might find that this hip is more symptomatic at that time. So that's also a time. So, you've got 3 joints and they're all connected together. So you have the sacral iliac joints and the sacrum, and at the front is the third, which is the pubic symphysis. And ligaments, sacral tuberous ligaments especially, those are what we work on when we do the sacrum procedure. They all make it stable. So I'm going to show some images in a bit, but we often see this again with post-pregnancy, post-delivery, and where the hormone relaxin causes the ligaments to soften and the pelvic joints to become more mobile. And of course that's positive because you get to give birth, but it's that retraction of those ligaments that can deviate the posture so strongly. And that can refer all throughout the body, from the front to the back, from the back muscles to the abdominal muscles. And there you have this pelvic instability. And so one of the most important procedures in Bowen therapy is the pelvic procedure. There's nothing like it, whether you're a Bowen therapist or chiropractor or massage therapist. If you were to do the pelvic procedure, you'd have incredible results. And I think that's underestimated in the effect of Bowen therapy, how powerful it really is at treating these kind of conditions. So another one is hip impingement, and we usually see this in younger people, athletes, often a sports injury. And there are 3 types of impingement or constriction in the hip ring or of connective tissue, or the hip cartilage becomes trapped between the femoral head and the hip socket. So this can be named cam impingement, and pincer impingement, and then combined impingement, where both anomalies are present. So basically, range of motion issues and focused pain is what you'll see there. So very different than osteoarthritis, that the bursa of the tendon is inflamed. So often the insertion or the attachment, usually it's the attachment in the groin that we see the most symptoms. You can have this as an inflammation, and it can be extremely uncomfortable. I'll upload a finished product. Yeah, you can see I'm dropping frames.